Hi, I'm Michele. Nice to meet you.
My doctor had wanted me to see a nutritionist, my oncologist, because I was just informed that I had mucoepidermal carcinoma.
Oh, I'm sorry.
My salivary gland. So he wanted me to check with the nutritionist and see what kind of diet I can go on after radiation so that it can help me with my treatment. So I had a couple of questions of things of my favorite foods. So I just wanted to kind of go over that before, because maybe after radiation I'll be there, come and see you as often as I should, remember all the questions I have. As far as meat, is there any meat that I should be staying away from, or because it might be hard for me to swallow, chew?
Sure, meat is a great addition to your diet. Limit the amount of fatty type meats that you eat, and I would try and stick with portion sizes of about 8 ounces, maybe 2-3 times a week. And choose lean meats preferably. Don't choose ground meats, don't choose sausages. Try and stick with fish, poultry, lean cuts of red meat. Those will be your best bets.
Oh, okay. And milk. I love milk. Is that something that would make the cancer cells or linger around? Because they're not really sure they can get all of it. So it's not something.
Milk's a great thing to add to your diet also. I would drink moderate amounts or have moderate amounts of dairy foods, including skim, non-fat milk, low-fat or non-fat cottage cheese, yogurt. Also, low-fat cheeses are great to add to your diet.
Okay. And I love coffee. So as far as like the milk that I put in it should be skim?
Skim.
Oh, okay.
Skim.
Okay. And coffee, should I be limiting that amount as well?
Up to 2 cups of coffee a day is fine. I would choose the skim milk, not a dairy creamer. Don't choose non-dairy creamer either. It's high in fat and sugar. If you would like to have more coffee than that, choose decaffeinated coffee would be just fine.
Okay. Juices. So is it better to do natural? Because I know that some of them that you buy in the store are like really sweet. So which is actually better?
If you look on the label for fruit juices, it say no sugar added. Okay. It will still have fructose or fruit sugar in that juice. Vegetable juices are great, and homemade juices if you have a juicer. It's a great addition.
Oh, okay.
But do limit the quantities, because I wouldn't have more than two glasses or so a day, and 8 ounces is a serving size for juice also.
Oh.
Any beverage, 8 ounces is a serving size.
Okay. And I love chocolate and tea. So how can I limit that? Because I've heard that it might make it worse, or be a problem anyway.
Both chocolate and tea have antioxidants, which we all hear about. They're supposed to be good at preventing cancer. Chocolate, though, does have lots of fat and sugar in it also, so you're getting empty calories. You're not getting lots of nutritional value from that. So I would definitely limit the chocolate. Tea, on the other hand, is great. Drink it in as much as you would like, just keeping in mind caffeine levels. If you have a problem with high blood pressure, caffeine is something that you have to be aware of. So.
And so, like in the teas, if I needed a little sweetener, is it better to go natural or like NutraSweetener? Those natural?
There is very little difference between so-called natural sweeteners and regular white sugar. They're all metabolized by the body in the same way. Artificial sweeteners, on the other hand, I would definitely limit my use of those. There's been no scientific study that's shown that artificial sweeteners cause cancer in the normal amounts that people use them. The studies that have been shown to increase the possibility of cancer, the rats were given many hundreds, if not thousands of times what we could ever eat in a normal day or week. That being said, try and wean yourself off the sugar fix and just gradually decrease what you would normally, what you would normally like to have.
Okay. And as far as like supplements, should I be, since I'm going to be cutting back on certain things, should I be using supplements to help or?
Not a good idea. Studies haven't shown that special diets, foods, vitamins, minerals, herbal supplements, or combination of these are helpful at all in preventing cancer or slowing its growth or keeping it from reoccurring. So, in fact, some of these products can affect the way your cancer treatment will work. So it can have a negative effect on you. If you are going to try any sort of supplement or any sort of new radical diet, ask your doctor first.
So does it help that I don't drink and smoke alcohol and drink
Absolutely. Both drinking and smoking have been shown to cause certain cause and increase your likelihood of developing certain types of cancer.
Well, I think that about is all the questions I have for today. But can I make another appointment if I think of any others before I start radiation?
Sure.
Okay.
Sure.
Well, it was a pleasure meeting you.
It was very nice meeting you too.
Thank you.
Thank you.